Well, thank you for that kind introduction. Thank you all for being out here tonight. I actually got off the hook. I'm supposed to be taking the kids to swimming lessons, but we got a fall cold, so they couldn't go anyway. So I'm not getting in trouble for being here myself tonight. So thanks for being here. Basically, I've got 45 minutes to present to you, which is pretty tough. I'm used to teaching 3-hour classes, so you may have to throw something at me if I go over an hour. But we've got 45 minutes for me to present, and then 45 minutes for you to ask questions. So lots of time for us to have a dialogue and to think and learn through these issues together. And so really what I wanted to talk to you is about homelessness. And like was mentioned in my background, this is my area of practice when I was a registered nurse, and has gone on to be my area of passion and interest as I try to do research in the community that we can apply to try to find some real solutions. And so that's what I feel like my role is, that I can help produce some evidence that we can put into practice in our community and try to really change people's lives. And when I worked as a registered nurse, I loved the work. I really enjoyed being able to help kind of one patient at a time, get to know them, and be able to assist them with whatever their struggles were. But at the same time, I was kind of frustrated because I was seeing this patient and then 2 patients and then 3 patients and 4 patients and, you know, more and more patients every week signing up to see the nurse. And I was thinking, okay, I'm helping one at a time, but something else is happening up here that's making the situation worse, and who's dealing with that? And as I looked around, I wasn't seeing a lot of work being done at that higher level to ask the big questions of why are people becoming homeless in the first place, and why do we need to have nurses who work with homeless people? And so that really drove me back to the university to get more education so I could do the research and produce the science and the evidence to make good decisions. So this is what I have to share for you is a little bit of my thinking along the way, and it's by no means the answer, no means the solution, and I feel like I'm always learning, and every time I present to people and hear your thoughts and questions, it helps me grow my thinking as well. I actually had the privilege, there's a group called City Symposium that meets, and they have get-togethers where you can present an idea. And so I ran this by them and said, hey, here's what I'm thinking. I'm supposed to present this as a class. Am I making sense here? And so I think we continue to grow and we continue to learn as a community. So take my ideas as just that, as ideas, and judge them yourselves for their merit and how we can use them in our community. So the first thing I want to do is start with a history lesson, which is a little awkward, although I'm losing my hair. I think I'm not the oldest in the room, so excuse me if I get the history wrong. This is my reading of the history, and you can correct me as we go. Actually, I'm at an age right now where my friends are starting to go gray as well, so us premature balders start to feel a little better at that time. So my history starts pre-1970 in Canada. One of the interesting things is, if you start to do a historical review of homelessness in Canada, you don't really find anything pre-1980s. And you look, and all the research, all the policy documents you can find, there's really not much in Canada before the 1980s. So why is that? What did it look like back then? Well, pre-1970 we had slums. So if you were in a major urban area in Canada and you were in financial straits, you could find a place that was a roof. Now, of course, by their very nature of being called slums, it wasn't a necessarily particularly healthy, safe, or dignified place to live, but it was a place. And there were slums in all communities. We've got Toronto pictured on the bottom there. And then you had, a few transients, often tied more to shifting labor markets. And so people would often kind of ride the rails or move from community to community following the work, particularly around seasonal work, farm work. People still do that. Now, they don't necessarily ride the rails to do that. But there wasn't the same kind of street homelessness that you would find in our communities today, because people could retire to the slums for their place to live. Now, we had this war across the world, and post-war really changed the Canadian perspective. And so as we came out of the war, there was a new sense of doing better. And this sense that we as a community can take care of each other, and that maybe we do have enough resources to do well. And so post-war, you had an enthusiasm that led to things like the Canada Health Act in 1966 and our public health care system. Design of a lot of our social safety nets and employment insurance. Also, another thing that happened at that time was building codes. And so there was a sense that it's not right for Canadians to live in slums. And so across Canada, we introduced building codes to say there's a minimum requirement of safety for our housing. And so that happened in the 1960s. And so in the 1970s, they started exploring the issue of the slums and saying, okay, these are now illegal because of our building codes, but this is going to displace people. If we just bulldoze our slums, then people are going to need somewhere to live. And so what they did is they started creating social housing. And so social housing was created en masse so that everyone who needed housing got it. So if you were being moved out of a slum or if you were becoming newly homeless, you were guaranteed to be provided with at minimum an apartment, a place that you could stay at whatever your income was. And so we built 136,000 social housing units across Canada. Most social housing that we've built since, really, was 1970s, most social housing. In London, you might recognize some of these buildings. We've got 241 Simcoe, we've got McNay Street in the middle, 580 Dundas. So we built a lot of the social housing. The model is a little bit questionable because we know that the way we built social housing comes with some challenges. If you put a lot of people with the exact same difficulties into one big building, then there are challenges that come with that. So perhaps not the best model of how we built it, but at least people had a place to stay. And so you don't have street homelessness in Canada in the 1970s. If someone needed a home, they simply built more social housing. Well, something happened in the 1980s. We had a shift across the developed world on the political spectrum. And so there was this shift from the post-war enthusiasm that got really kicked by a recession. So recessions across the world in developed nations, and it really shifted the tide of the conversation from we can take care of everyone to everyone can take care of themselves. And so you went to this real shift of pull yourself up by your bootstraps. And so of course we had Reagan, Thatcher, Mulroney here in Canada for 9 years as Prime Minister. And it's in the 1980s that you start to see the rise of homelessness in our communities, because what they did is they stopped dead building new social housing. And so you actually have no new social housing built in London apart from, a couple church communities and small organizations maybe working with adults with disabilities. No social housing built for a period of 15 years from 1980 to about 1995. And so then what happened is new people continue to have crises in their lives, end up being dehoused, and there was nowhere for them to go, and so they end up on the streets. And so suddenly you have crises across the UK, Australia, Canada, the US, people saying, there are homeless people on our streets. What is this? What do we do about this? And so you have 1987 as declared as the International Year of Shelter for the Homeless, because the developed world was saying, oh my gosh, we have a problem. We have people living on our streets. This is new and we don't know what to do about it. We have to fix it. Now, unfortunately, you see that was a while ago, and we still have some work to do. But there was a reaction. So in the 80s and into the 90s, we started seeing homeless people in our communities. And we as a community started to say that this is not okay. And so we had a charitable impulse, a charitable reaction, which says we want to help folks. And so we started building shelters. And so you see a development in the 1990s of 400 shelters across Canada, 400 new shelters built in the 1990s, which is a sense that people are homeless. We need to provide them somewhere to live, somewhere to stay. Same time, actually same timeline as food banks. So you had the opening of food banks across Canada in the 1980s. Both the emergency shelters and the food banks, if you've listened to Glenn Pearson, were meant as temporary Band-Aid solutions, because we knew that food banks don't end hunger and shelters aren't housing, right? So we knew that at the time we were developing, but we said we can't let these people live on the street. We can't let people starve to death. We have to have some kind of safety measure. If our government's not going to do it, then our communities are. And we'll step up as communities and we'll help people. But we knew those weren't good long-term solutions. However, they live on with us today. So what's the current situation? The current situation is we actually have over 1,000 shelters across Canada. So that was from 400 built in the 1990s to over 1,000 today, representing 28,000 shelter beds. And so these include emergency shelters, family shelters, and violence against women shelters. And across those 28,000 beds, we have 146,000 unique individuals stay in shelter in Canada for at least one night. So we have a lot of people in our communities who end up in a crisis situation where they don't have housing for the night. So the total, if you take all of the individuals across all the shelter beds, is over 5 million shelter bed nights. So we have a lot of spaces required for people to have somewhere to live and have somewhere to stay. The other thing we note is some trends, and we'll look at some of the London trends, but we notice the number of children going up. Children and youth are our fastest growing population. You may have seen, if you follow the London Free Press, that coming out, that's local as well. So this is Ontario stats. The same holds true for London. And so we know that people living in shelter have barely better health and social outcomes than those living absolutely homeless, right? So we knew that this was just a Band-Aid, and it's not quality housing. It's not permanent housing for people. And so we have statistics about the people who are staying in shelter. If you're chronically staying in shelter and you're a man, you only have a 32% chance of living to the age of 75. Average age of death. So if you look at all people who die while living in shelter, average age of death in Toronto, 47 years old. Right? This is not a safe and a healthy situation. Chance of women surviving to 75 who are chronic shelter users, only 60%. Increased risk of suicide for women staying in shelter 6 times, 600% increased risk of suicide for women staying in shelter. So we know that this is not a permanent, healthy, long-term solution. This is not what the vision should be for our community. So what does it look like in London? The stats we have in London, I have to start by saying, are only for those who access emergency shelter beds. Now, when we think about kind of the whole spectrum of people experiencing homelessness, we know some people also sleep rough, right? So we do have some urban campers down by particularly around our green areas, particularly in the summer. And then the larger group are what we call our hidden homeless, which is people who might be crashing in empty spaces. It could be families tripled up. It could be youth couch surfing. But people who don't have their own safe space to stay. So these stats just represent our shelter bed use. Of that, we have 330 emergency shelter beds in London, and those run at about 85% occupancy. So there is good news and bad news stories in all of this. The good news story is we are not at 115% occupancy like they have in Toronto, like they have in Vancouver. And I'll tell you a little bit more in a bit about why I think that is. Total number of unique stays in shelter, our most recent statistics are from 2013. In London, we're 3,143. 3,143 Londoners required emergency shelter in 2013. That's a lot. That's too many, in my opinion, and probably in yours. But that's down from 3,400 in 2011. So again, good news and bad news in this statistic. So we are seeing a decline, and again, I'll tell you a bit about why I think that is. It's also interesting to look at the variation within the population accessing shelter. That variation being that a third access shelter less than 5 nights. And so this third are folks who are resourced enough that basically they can take care of themselves. Right? They're in a crisis situation, but that crisis is solved without kind of extensive intervention. They're able to find their way into their own housing. Now there's another third whose stay is between 5 nights and 30 nights. So I think that's problematic. That puts people at kind of all kinds of other risks. But then there's this other third who are the chronically homeless. And these are those who have more than 30 nights a year. And that runs all the way up to 365 nights a year. And so there's this population who emergency shelter becomes their fallback housing, and we know from our previous statistics that that's not good for them to be in emergency shelter for a long period of time. The other interesting trend is the age distribution, and as I've said, we're seeing a growth in the bottom end, which is children and youth, from 9 and 12% up to 11 and 14%. So we're seeing the increase in children and youth. We're seeing a decline in seniors from 8% down to 7.2%. I think the decline in seniors is the fact that we're getting better at working with seniors to get them the income they're entitled to. And so that is the primary intervention for homeless seniors, because if you're getting your income that you're entitled to, it's at minimum about $1,500 a month, which will get you into market rent housing. And so the first step for seniors is always, are you getting your GIS? Are you getting your OAS? Are you getting your CBP? Are you getting the income you're entitled to? I think we're getting a little bit better at doing that. But this is worrisome about more children and more youth in our community accessing emergency shelter. Yes?
And that's including like women's community housing?
Yes. Yeah. So, what is this problem about in London? Well, part of the problem is about the gap between housing and income. So I mentioned seniors at $1,500 a month. That gets you into kind of your minimum market rent. The challenge is that on social assistance, your housing allowance portion of that social assistance, which is right up here, is $376 a month. So that's what we give to people who are in absolute poverty. $376 a month leaves you about $200 shy of the average market rent for a bachelor apartment in London, which is about $575. And so you've got this real gap between your income and what it costs to get into housing. And so people are looking for rent geared to income social housing. Right? I can't afford to get into the market rent, so I need the government assisted housing. The wait list in London is 2,341 households. We're in a plus minus annual situation of about 60 to the good family units. So we move, about 300 people into social housing, but we have about 240 for every 300 get added onto the list. So we're moving that list, but at 60 to the good each year, it's going to take us a long time to get through that social housing wait list. So you have individuals who are waiting on the wait list, but that wait list can be 2, 3, 4, 5, 6 years, depending on what housing you apply for. And in the meantime, they can't afford to get into market rent housing. So there's a real gap in people's ability to afford housing in our community. So that's one of the causes, right, is just straight up income. But what leads each individual and each family to have a crisis? What I think of it as is this series of unfortunate events. The Homeless Hub is a resource in Canada, and they state that most situations, homelessness is caused by the impact of several different factors over time rather than one single incident or cause. And so when I worked as a nurse with people who are homeless, I got to know them. And that was one of the really neat part of my job, is talking to people and hearing their stories and understanding where they're from. And that's what I found, is it was all often these compound issues of, fleeing a violent partner and, an incidence of a new mental illness, combined with that leading to job loss. And it was these compounding effects of these series of unfortunate events that led people to become dehoused, to not have the income needed to make that gap in terms of housing. And so there were common pieces of stories: violence, trauma, relationship breakdowns, substance use, poverty, mental health challenges. But if you look at each of those individual situations, the majority of people who experience that don't become homeless, right? So the majority of people who experience violence in a relationship don't become homeless. The majority of people who have a mental health challenge aren't homeless. The majority of people who live in poverty aren't homeless. And so for a select group of individuals, it's the compounding effects of these events that make it so that they become dehoused. And of these individuals, there's a 30% who really struggle to then rehouse themselves without some kind of intensive intervention. Another cause, I think we need to continue to think about the systemic factors. And so if we're saying the gap between one's income and ability to pay rent is leading people to not be able to get into housing, then we need to think about how are we doing on social housing. And I think there's a pretty clear trend to be seen in federal investment in affordable housing. And so I think we need to continue to question that and maybe hold the new government to account and poke them while they're fresh to see what we can do about ensuring that we are adequately funding affordable housing in our communities. So those are some of the causes. So compounded, difficult life experiences on top of having systems that have inability to meet the breadth of the need. So what is the solution? So in the work that I do, I hear on a daily basis, I heard in Utah that they've ended homelessness. And have you seen what they're doing in Medicine Hat? Yes, I have. Several times heard about what they're doing in Medicine Hat and what they're doing in Utah. What are they doing? Well, they're doing something called Housing First. And this is where the science and the social services come together to use best evidence to understand best practices. And so they've actually done studies. This started in New York City with a group called Pathways in the mid-90s. And what they did is they looked at these individuals and they said, you've got complex challenges in your lives and you need some various supports. So what we're going to do is we're going to offer you, and you can choose. And so you can choose to get treatment for an addiction first. Or you can choose to get support for your mental health challenge first. Or you can choose to enter an employment program first. Or you can choose to do work to reconnect with family first. Or you can choose to be moved into housing first. And they took those individuals and they made it basically a natural, randomized, controlled trial where different people selected their choices. And then they saw how that panned out. What they found is the group that had the most success was the group who had housing first. And so what that demonstrated was that housing serves as that firm foundation by which you're able to address the other factors in your life. And so if you're struggling with a mental health challenge and fighting for where you're going to stay the next night, it's really hard to move into recovery for that challenge. If you're trying to find a job and you don't have an address to put on your resume, it's really hard to gain the employment. So what they found is that housing is the best foundation. The other thing that happens is, remember that I introduced that staying in shelter is not good for your health and well-being. So the more quickly we can move you out of shelter into housing, the more we can prevent some of those other social and health challenges that come from being in that space. So, housing first. what are the principles of housing first to make it work? So it's not just stuffing people into apartments that they don't want, right? That doesn't work so well either. No offense to London Middlesex Housing Corporation, which does as best as they can with the meager resources that we give them. If you talk to lots of folks who live in London Middlesex housing, they don't always love the space where they live, right? It's what they can get for what they have, but it's not necessarily the home that they want. So what are the principles of housing first? Consumer choice and self-determination. So housing works for people when people have some choice about where they live. Immediate access to the permanent housing with supports. So we recognize that a lot of folks who become homeless have become dehoused because of particular challenges in their lives. If you don't give them support, you're going to see them back at shelter again, right? So some people need some help with their everyday lives. No preconditions or program requirements. So what we used to do was we thought that there was this pathway to housing where once you prove that you can go to your psychiatrist appointments or be sober or participate in our group work or whatever, then we would let you transition into some kind of partway to housing, and then if you could demonstrate outcomes there, we'd let you get into housing. But what we found really happens is that those negative health and social consequences of being in the shelter outweigh people's ability to meet those requirements to transition into housing. So no requirements. Get you into housing as quickly as possible with the right supports into the housing of your choice, and to build in social inclusion, self-sufficiency, and improve quality of life and health. And so what we find is the last piece of the puzzle is that moving people into housing is great. Having their support come out to where they live is great. But you don't want the social worker to be your everyday friend. You need to help people become integrated in their community, right? That needs to become someone's natural community. And so that ability to assist people into becoming included, belonging, and being part of their community is the last piece of the puzzle for housing first. So people tell me they're doing this in Utah, they're doing this in Medicine Hat, and I tell them we're doing this in London. Good news, right? We're already there. We know what works, and we're starting to implement it. So we have over 100 chronically homeless people in London who have been moved into permanent housing. An interesting piece of the stat, I didn't tell you about our shelter situation in London. I mentioned we had 330 shelter beds at 85% occupancy. 3 years ago, we had 380 shelter beds at 85% occupancy. By moving 100 chronically homeless people into permanent housing with supports, we've been able to reduce the number of shelter beds we have without making the rest of them too full. The nice thing that does is it lets us take money we're spending on people in shelter and spend it on keeping people in their homes. So we actually pay $47 a night per shelter bed. That's a lot of money. We're talking $1,300 and something. Someone who's better at math than me can tell me. $1,300 something a month to keep someone in shelter. And so if we can move folks out of the shelter system, we can use that money to support them in housing. So this is what we're doing. Homes for Women is a collaboration of Women's Community House, My Sister's Place, and the Nurse Practitioner-led clinic. London Cares is a collaboration of Addiction Services Thames Valley, Unity Project, and someone else who I'm forgetting off the top of my head. Canadian Mental Health Association provides community mental health services. All of these groups are using this model, taking people who have been chronically homeless and moving them into permanent housing of their choice with supports. How do they make it work? Number one is they do rent subsidies. So the $376 a month does not get you into housing. So we've got a problem if we want to rapidly rehouse people, because waiting 7 years on a social housing wait list is not rapid rehousing. So $200 a month, though, bumps that person from unaffordable into market rent. And $200 a month is a lot less than the $1,300 a month to keep them in shelter, right? So the rent subsidy is piece number one. That rent subsidy, along with the person's housing allowance, is paid direct to landlord. So you can go to landlords and say, 100% honest, this individual has some challenges. They haven't been housed for a while, but you're getting paid every month, which is step one. And if you're a landlord and you've got vacancies, which we have a 2.3% vacancy rate in London, which is another good and important part of the picture, because if you're in Vancouver, they've got a negative 0.4% vacancy rate, which is a whole other problem there. So we have empty apartments. We have landlords who want to make money. They want people in those apartments. So we pay that money direct to landlord. The next thing we do is we reach out to landlords and we get them to buy into this idea. So that when an individual is ready for housing, we have a number of apartments on offer. Right? We can go to them right away and say, great, we've got 8 landlords, different areas of town, different types of building, what kind of housing, where in London do you want to live? And we have those kind of in pocket ready to go. The next piece is 24/7 mobile support. So that landlord and that resident both get a cell phone number for a worker, and that is staffed 24/7. So if anything happens, call us, right? You're having some frustration, a window has been broken, or something isn't going well, there was a flood. Call us any hour of the day, and we will come out and support that individual, and we will come out and support you. So 24/7 mobile support. And lastly, integrating that individual in the community. Because what we can't afford to do is for that 24/7 worker on call to provide all of the services that person could possibly need to become integrated in the community. So we still rely on the rest of our community agencies to support people to become a part of their community. Recreation programs, things like the soccer program that I know David's here from the soccer program, street soccer. Those programs that help people become part of their community. We need that, and we need that support. So this is an example. This is participant 8 from London Cares. So they started with 50 individuals. So what they did is they had agencies identify the 50 highest users of service. And London Cares said, we are going to house those individuals if they want housing. And funny enough, they all did, which is another incorrect assumption that people want to be homeless. We actually did a survey. We were doing other surveying, but we thought we might as well ask along the way. We surveyed 200 people about their mental health and other challenges. One of the things we want was, what was your preferred housing status? Funny enough, none of them picked homeless. So they said, we are going to house these 50 individuals. Funny enough, agencies at first were totally skeptical. They said, oh, yeah, right. We've tried, right? They just get dehoused again. They'll come back. But whatever, you try and see what happens. Well, this is what happens. This individual had over 200 emergency room visits in 1 year prior to entering the program. Can you imagine what that costs? Imagine the cost of the ambulance to pick that person up, take them to Emerge, sit with them outside of Emerge, for the individual to be seen by a physician, to stay in that emergency department overnight, to be let out again. Over 200 visits, essentially living in our emergency room, right? After introduction to the program in August of 2012, their emergency room visits went down drastically. Most importantly, the rest of those emergency visits that you see were for legitimate health challenges. You can imagine that this individual who'd been chronically homeless for over 30 years had a lot of real health conditions that required some particular care, such as liver disease and abdominal bleeds, but was no more using that emergency room as their place to live. So that's the outcomes that we see. What does this mean? You can't see all of these numbers, but happy to share this graph from you. This is costs of different places where people might access service. Right at the top here, of course, we have hospital acute care beds as the most expensive. But each ambulance trip costs our system between $600 and $700 per ambulance trip. Each emergency room visit costs between $200 and $800. That's pretty much the difference of whether the doctor sees you or not. And so that's incredible, thousands of dollars. You may have heard the Malcolm Gladwell story. It's called Million Dollar Murray. Million Dollar Murray was an individual that they followed in New York who was using over $100,000 of services just himself in a year. And so in his 10 years of homelessness, he consumed more than $1 million of services. At the bottom here is supportive housing. $40 to $100 for supportive housing. So taking the money, providing people with the housing that they want and that they deserve, ends up being a lot cheaper. That's the story of Utah. Utah, as you may imagine, is not a particularly liberal kind of state. Utah mayor, 100% conservative, will say, I did this for the money. Be honest. I'm not doing this for the social good of our community. I'm doing it because it's saving us a lot of money. Utah is taking all of their chronic homeless population and housing them with supports because they want to save money. Hey, whatever works, right? Sometimes we do it for heart, sometimes we do it for the wallet. Both of them make sense in this situation. So, what does solving houselessness look like? I have a model, which here's where I get really nerdy and academic and you all fall asleep, about what this looks like. I'm not going to take you through this model, of course, but what I wanted to highlight is that we have a sense of what it takes to move everyone into housing. It includes things like a big prevention net, to make sure that people don't become homeless in the first place. Things like preventing eviction, things like planning discharge from hospitals, planning discharge from jail, that we're not just kicking people out on the streets. How can we prevent homelessness from starting in the first place? And then street outreach and rapid response, so that if there is crisis, if people do become homeless, that we connect with them as quickly as possible before some of those other challenges come up. And move them into the right housing. So whether they land in temporary shelter, we push to moving them home. And as much as possible, we jump right from that outreach to home. And know that some people will require home to be more supportive. So some people it's a medical respite if they have severe medical conditions. For some people it's home that deals with their addictions. So addiction supportive housing, for example. But moving people to that home, for some people they just need affordable housing, right? And for some, they can get into market housing, they just need help to get there. And then lastly, all of the pieces in our community to integrate people in. In this particular model, I was looking at women. So one of the things we also talked about is that our system needs to be responsive to the unique needs of unique women. So if we're talking about women who are veterans, if we're talking about First Nations women, if we're talking about women who are leaving the sex trade, we need to obviously meet the unique needs of each woman, but ultimately it's to help people find home and get them integrated in their community. So we know what that looks like. And so I think we can envision in our community the end of people not having housing. And so we would need to set our target that we can live with and we can agree on that would say no person spends more than X nights in emergency shelter, because we know that people will still have crisis. So you need a landing spot. But the idea is that that crisis center isn't where they live. Right? So maybe it's no more than 3 nights, maybe it's no more than 1 night of emergency shelter. And we'd also say that people who are absolutely homeless are connected with an outreach worker within X number of hours, X number of days. So we say if people hit the streets, that we're out there to find them, to help them so that we can get them rapidly into the housing. And lastly, that those who are hidden homeless, by their nature of being hidden, we can't find them, but if they want help, if they reach out, that we're able to help them immediately. So somehow we could set these metrics that we as a community could live with. Medicine Hat, they set it at 14 nights. No one's more than 14 nights in emergency shelter. To me, that doesn't quite fit 14 nights feels like a bit too long for me. I think in London we could set a more reasonable and kind of a more aggressive target than that. So that's the end of houselessness. But it can't mean just putting people into apartments where they're not going to do well anyway. Because that apartment is not necessarily a home. So you noticed I changed my language from ending homelessness to ending houselessness. Because I think we as a community can get a lot smarter about putting walls and roofs around people. And I think we need to do that. I think that's an important first step. But I don't think that necessarily solves the end of homelessness, because what is home? George Carlin says a lot of really horrible things. He also says home is an abstract idea. It's a setting, it's a state of mind. So what does it mean to be home? What does home look like to you? We actually asked. So we talked to women with lived experience of homelessness, and we said, what is home? What is it that you are seeking? And they told us lots of things. They said home is a right, and they're right. It's in the Ontario Human Rights. It's in the Canada Human Rights. It's the right to shelter. Right? So home is a right. They said home is safe. They said home is affordable, and we know there's a gap right now in our community. They said home is quality. Quality is a big discussion in London right now, because if you've been watching the news, you've seen the fires. So we know that people who can't bridge the gap between their income and the cost of market rent housing go into what we call the gray market, which is substandard, unsafe housing. It's landlords who are willing to take the $376 that they get because they're providing them cheap, inadequate, unsafe housing. So home is quality. Home is permanent, right? It's not moving people from one transition home to another to another. Home is self-determined. Home is autonomous. Autonomous means I get to choose who comes and goes from my home. When I talk to people who are homeless, one of the images that they share with me most often is that image of a key. So to be able to lock your door and to control your space is a very powerful thing for people, especially who've been forced into living in group settings and unsafe settings where you have to tuck your goods under you as you sleep at night so no one steals them, where you have to sleep lightly in case someone attacks you in the night. So the sense of autonomy over your space. Home is supported if necessary. Some people need some help, and that's okay. We should be able to help them. Home is accessible, physically accessible, but also spiritually, mentally accessible. Home is inclusive of family members, and the women told me every time I say that, I must say that that includes pets. So people's family include their pets. So if we're telling people you're moving out of the shelter to this place and this place does not take pets, that will not be home for that individual if they have a pet. Home is free from surveillance, which has to do again with the key and who comes in and out of your home. Home is community, it's belonging. From First Nations women, we heard that home is land, so where you live and the meaning of that land is very important. Home is private, or as private as you want it to be. Some of us like busy homes, some of us like our space. And lastly, home is not burdensome to others, because if I feel like I'm bothering someone else by living in their space, I don't feel home. So what does that mean? Well, I took what is probably made you feel easy and comfortable. Yes, we can solve houselessness. We can get walls and see roofs around people. And I hope I'm making you feel a little bit uncomfortable again, which is the idea of ending homelessness is bigger than the spaces that we can put people into. So I think homelessness and solving homelessness has to do with social inclusion. I think there are big questions there about who belongs in our communities and the barriers that we put up to certain individuals. And I think those raise deeper questions than can we shift our money from shelter beds to housing first? But I believe we can do this. I think we do need those local strategies of that model I presented to you. Absolutely, we need to do better in how we organize our services. But I think we have some big questions to ask our community about how we can better include those who are at the margins. These are questions around working together as a community. These are questions around asking tough questions about racism and sexism and family violence and cycles of poverty. Those tough questions that get at some of those bigger challenges of social inclusion and who has access to resources and who doesn't. We as a community need to respond better to trauma. People experiencing violence, people who have mental health challenges based on that trauma. We need to be more open to those experiences of trauma and help people better. Our solutions need to be led by those who are affected by the problem. Those who are homeless need to have a voice in telling us how we can better, as a community, bring people in from the margins. And lastly, we need to look even higher than that. We need to look bigger than our community to our nation and how our justice system works and how we have a system right now that does the opposite of rehabilitating people. We have to look at using our research better to be informed by evidence rather than by whims of whatever the government of the age is. We need to look at child welfare systems, at setting children up for success. Why do so many of youth exit child welfare into homelessness? If we had all these years of them in our system to help them, why do we do the opposite of helping them? We need to look at discrimination. Why are so many people on our streets who are refugees and new immigrants, who are Aboriginal and First Nations people? We need a national strategy on housing. We need a national strategy on poverty. We need to look at real work that ends domestic violence in our communities. So I think if we want to end homelessness, we need to start asking some of those bigger, tougher questions around how our society pushes people to the margins and how we can then bring them back in. So I think ending houselessness means a better use of our resources and a system that is better coordinated. Ending homelessness means inclusive communities, it means compassionate policies, and it means returning to being a caring nation. Returning to that enthusiasm of the 1940s and the 1950s, where we said we can bring everyone in from the margins. We as Canada have the resources and we have the compassion that everyone can have what they need to survive. I would love to hear your thoughts and your questions. So thank you for your rapt attention.